Guys, so they asked me to talk about updates in neurology, and initially I was going, okay, I'm going to do everything in neurology, but then I decided too big of a topic. So I said, like, okay, what would be practical for something for you guys that actually you can use today? So Anita's talk was about, okay, we can diagnose patients with long COVID, but what do we do, right? And my talk is going to be, can I see a person with headaches, what can I do today to make a difference in their life and be the best physician ever, okay, for their patients? So that's what my talk is about. So I'm going to be talking about neuromodulation devices. It says for migraine treatment, but I'll tell you actually majority of the headaches you can use it on, but you're going to be surprised because a lot of the patients that Anita was talking about, the people who have low energy, cognitive fatigue, this helps as well. So I'll tell you about this. So I'm going to talk about how you can incorporate neuromodulation devices into your clinical practice starting today. And I'm going to tell you is exactly what Anita was telling you. In order to heal people who have neurological dysfunction, you need multimodal treatment. And big part of this multimodal treatment is neuromodulation, and I'm going to just discuss the cases throughout. So we're going to start with Jane. And Jane is coming to you today, and she is 45. She says, okay, I'm having headaches about 6 times per month. They last 6 hours. If I don't treat them, they're moderate to severe. It's right-sided pain. It's worsened by movement, and I have extreme light sensitivity. I have extreme nausea. I've tried a lot of the over-the-counter medications like ibuprofen and naproxen, Excedrin. And it does provide symptom relief, but it doesn't resolve my headaches. And it's a huge impact on my life. Because as you guys know, you cannot miss more than 4 days, right, per month without getting penalized by most employers. So she's missing 2 days per month. She would actually miss 6 days if she could, but she just doesn't have that ability. And so she's coming to you because she's very debilitated. So you ask Jane what kind of treatments she prefers, and she goes, no medication. How often do you guys hear it? Like who can raise their hand and say, I have a patient who comes like, I don't want, I'm coming to you as a provider, but I want no medication, right? And you go like, okay, so what am I going to do? So what do we do in the headache clinic? We actually do non-medication treatments along with medication treatments. And a lot of the treatments that Dr. Chopra was talking about, like supporting sleep, managing stress, exercise, supplements, procedures, nutrition, neuromodulation, we all do in-house. So how do I do it? I'm one person, right? You know, how do we do it in our clinic? So we do it as shared medical visit. So actually we do a shared medical visit on each of these topics. And we do cognitive behavioral therapy for insomnia. We do empowered relief. Have you guys heard of empowered relief? So all of you can become certified. You can Google it as a Stanford program for cognitive behavioral therapy. We do exercise shared visit, supplement shared visit, but big part of what we do is neuromodulation. And so what is neuromodulation? Have you guys heard of this term, neuromodulation? Some people have. So it's kind of an umbrella term, and it's using any device that will change my neuron activity. And the idea was changing brain electrical activity. So this is not actually a new concept. If you ever heard of Nikola Tesla, not the Tesla cars, but Nikola Tesla, guy who did quite a lot of electricity, if you read his biography, he actually believed that all of us should have electrical stimulation in order to improve our cognitive function. So he actually convinced New York schools, I don't know how they administer, I actually wanted to see how they administered electricity, and he goes like, okay, if we give people electrical stimulation, we can actually improve their brain function. So this is not a new concept, but so the idea here is how do we normalize the brain function? And so if you say, where do all of the neurological conditions begin? All of the headaches, which part of the brain do they start in? And so the study with functional imaging shows you that all of our headaches started actually in the part of the brain called the hypothalamus. And hypothalamus is just the old Greek word just means under the thalamus, under the chamber. And if you go into Wikipedia and look up what does the hypothalamus do, so this is the part that decides, did I get enough sleep? Do I have enough nutrition? Do I have enough hydration? How are my hormones, especially for women, estrogen, testosterone for men? So, and then the hypothalamus, if it gets to a certain threshold, if it goes like, okay, I'm sitting here, I didn't get enough sleep, I'm tired, I didn't get enough hydration, like I have my menstrual cycle, I'm stressed, like, yeah, I'm here, but I still have to think about my patients, and I'm getting tons of epic messages, right, guys? And so you get past a certain threshold where your brain goes like, I can't take it anymore, and it will activate alarm. And what is the alarm? It's the headache. So majority of us can get a headache anytime we go into low brain energy. The hypothalamus will decide that, and some people, it will be very easy to do depending on their genetics and environment. Some people will take more effort, but there's not a person here who I couldn't get into headache state if I push them hard enough, right? If I sleep deprive you, don't give you hydration, nutrition, I wouldn't do that to anyone. I'm just letting you know, right? So how fast will the hypothalamus then cause headache? It depends on how strong stimulus, but for most people, it's 24 to 48 hours. So RNMA did the study in Germany, and they found on functional imaging, 24 to 48 hours before you have a headache, the hypothalamus will activate. So you have some time in majority of the people, and then it will activate trigeminal vascular system, and many other parts of the brain get involved. Okay, so now, so the neuromodulation devices for headache involve a treatment approach that involves altering the brain function, the nerve activity within the brain to reduce the headache frequency. Now, and the mechanism, we use either electrical or magnetic stimulation in specific areas. We go through the peripheral nerve, and then it turns out you change the brain function using this approach. And techniques are variable. So we have at least 5 different devices that are available to your patients. The most commonly used is external trigeminal nerve stimulation. I'll talk about that. There's also other types like occipital nerve stimulation, vagal nerve stimulation, and remote electrical neuromodulation. So we're going back to Jane, and she says, yeah, after talking to you, I might be interested in the neuromodulation device, but I want to know, am I a candidate? Like, is it something, okay for me to use? It sounds like really weird. I've never heard of it, right? So am I a candidate, and which patients can be helped? And so it turns out almost everyone, patients who are looking to bolster their acute and preventive treatment, people who are at risk for medication overuse. And I can tell you in our headache clinic, 50% of patients that we see, not everyone, we sometimes feel like it's everyone, but 50% of our patients take acute medications like Tylenol, ibuprofen, etc., and guess what? It makes their pain and headache worse. So if I start taking triptans, so like sumatriptan, rizatriptan, the most common medications, prescription for migraine, if I use them more than 4 days per month, and I have stress, I start being at risk for medication overuse. We see this all the time. If I take them 10 days per month, 100%, I have diagnosis of medication overuse headache. But it's not just the triptans. I have to count everything I'm taking for acute treatment together, apart from the new medications. So new medications, like the Gepants, like ubrogepant, Nurtec, or imogepant, do not cause medication overuse. But anything that we've had before, Tylenol, ibuprofen, etc., causes medication overuse. And so if I'm taking 10 days of Excedrin per month, 100% I have medication overuse. So what do I then do? I can use neuromodulation. What if I prefer, again, not to use medication? So many people will say, I prefer not to use medication, but what do? Take daily Tylenol. They go like, I'm not, and I go like, isn't that medication? They go, no, it's like over the counter, right? Like, I don't need prescription. So therefore, it's kind of that very interesting division in our heads, right? Like anything that I can get myself, it's not medication. It's only if I go to a medical provider, it's a medication. And then you have many people who have contraindications because they had a stroke or heart attack or, have complicated rheumatologic conditions or other conditions, and they just can't take other medications. And many people have limited access. And this is the interesting part that you'll find out, that many people who don't have insurance, can actually get the neuromodulation devices without a prescription. So there is only one device that is under 18 years old, so there are now the pediatric use, and a lot of pediatricians use them, even Cephaly, even though technically FDA approved it for 18 years of age and up. So Jane wants to try the device that was established first, because she goes like, I want the one that has the most evidence, right? I want the one that has been used the most. And so, which was the first neuromodulation device that was developed for migraine? And it was Cephaly. Okay, so it's transcutaneous stimulation. How many of you have tried Cephaly? Yeah, well done. And so everybody should try it, because then otherwise you go like, okay, people will tell you like, well, how does it feel? And you go like, I have no idea, right? So at least you have the idea, right? Everybody can come to you and they'll go like, okay, she knows how it feels. So it's FDA cleared. It has been used in the US since 2013-14. So we have 10 years of experience. On their website, they claim that to date, we have treated more than 2 billion headache attacks with Cephaly, 2 billion headache. So it's super, super safe. And it's external neurostimulation device. So how does it work? So you place an electrode on the skin with adhesive, and then it will stimulate the supraorbital and supratrochlear nerves, so branches of the ophthalmic nerve, the first branch of the trigeminal nerve, so kind of the green area, and you can see the patient is there relaxing, right? Looks very relaxed, right? Looks very peaceful. So how strong is the impulse? So the Cephaly generates a biphasic impulse with high frequency of 60 hertz. It's really low intensity, it's 16 milliamps, and it's aimed to avoid crossing the brain threshold while still being able to activate beta afferents, leading to paresthesia. So what a lot of the people will feel, they'll feel tingling. If you use low stimulation, you don't feel anything. At the higher, you can feel like, someone is like literally tingling the nerve, but it should not cause pain. If you have super sensitive patients, it can cause pain. Then what you want to do, you want to decrease that threshold of activation. And then it's a constant current generator. It delivers pulses of 100 hertz. And then intensity starts really, really low. It starts at the 16 milliamps after the 14 minutes, but it starts, really, really low. And then over time, if you keep it on, it can increase, and you can pause it at any level that you go like, wow, this feels okay for me. I don't think I can take more. Or you go like, no, I want to use even less. And so how strong is the Cephaly impulse? So the magnetic field that is produced is negligible. So it's compared, like if you compare it to an electric shaver or a hairdryer. So most people who are worried, you can say, have you ever used a hairdryer? Okay. So now Jane is open to trying Cephaly. However, she wonders, how does she use it? Is it acute? Is it preventive? How do I use it? And it turns out that you can use it for both. So people use it. We use it for preventive. We used to use it 20 minutes a day. So this is where I'm starting to go into the caveats. So I have many people that I see, let's say, for post-traumatic headache. So for post-traumatic headache, I'll have people use it 20 minutes twice a day to be more effective. And then for acute rescue, you can use it for an hour, but some people go like, no, an hour is too much. Use it for 20 minutes. And then we have about a third of our patients who come to our clinic don't have just pain, they have dizziness. So vestibular migraine, or PPPD, triple PD, like the persistent postural perceptual dizziness, so the triple PD. About a third of our patients have this, and so there is, Dr. Shinbei did research where he showed just 20 minutes of using this when you start feeling dizzy can improve dramatically your symptoms. So we don't use it just for pain. We use it, I have headache pain, but we use it also if I have any aura symptoms, like I can have vision changes or numbness or weakness, or I have the dizziness, or we use it for people who, Anita was talking about, who feel fatigued, I feel exhausted, my brain is off, right? I'm overusing medications. So we don't use it just for migraine. Any headache, you can use it for. Now, you said, Natalia, can you use it for autonomic dysfunction? Absolutely, you can. But we can commonly use it for the dizziness patients. So we have many, about a third of the patients that we see, it's dizziness. I feel off balance, I feel off. And so you can wear it any time of the day. We usually tell people to use it in the evening just because it's very relaxing and people feel much better with this. It turns off automatically after the session. So now Jane is wondering, what will it feel like, right? How does it feel? What does a person feel? And usually what we tell, most people do not feel anything. Some people who are very sensitive and they have allodynia will feel tingling. Some people can feel more of the sensation. It increases gradually and spreads to the forehead and front of the head, and after 14 minutes it stabilizes. Now, Jane is wondering, is it safe? Will cephaly fry my brain cells? Safety has been established. So cephaly was developed in Belgium, and a lot of the safety trials were done in Belgium, and it was considered super safe. So only minor and fully reversible adverse effects were reported in 4.3% of patients. The most common is paresthesias, about 2% of patients, arousal changes. Usually people feel sleepy, relaxed after using it. Some people say, no, it wakes me up. Some people can have headache after stimulation. It's very rare, but about 0.5% of patients. And you can have local skin allergies, so they have hypoallergenic electrodes. So it's considered very safe and well tolerated for migraine patients. But again, in the headache clinic, we use it for all headaches. Now, what is the additional supporting data? So Schoenen, who did a lot of studies in Belgium, and all of the studies are available for free if you go to their website, but showed that cephaly actually normalizes activity in cortical areas controlling pain and brain function. So if you do the single session, it will relieve your pain, but it does not change your brain metabolism. However, if you continue using this daily, the 20 minutes per day for 3 months, we now know that you can use functional imaging tools, like functional PET scans, and they show that before treatments, many people who have chronic pain have hypometabolic, means like my parts of the brain are shut down, they're not working properly, and some of them are hypermetabolic. And it turns out that using these devices actually normalizes your brain function, which is absolutely amazing. So you actually are improving brain function. And this is linked to the people who have this normalization that have much less pain. So what results can I expect if I start this device? How will it impact my headache severity and frequency? So what do critical trials show? And so for acute management, it shows that 1/3 of the patients will have no pain after 1 hour. 2/3 will have dramatic pain reduction. So what we found, because initially it was prescription, we found that in our clinic it was less than 10% of patients that it was not working for. That's what we're seeing kind of continually. So it works for 90% of patients, and some completely relieves their headache, and many dramatic improvement of their headache. What do we see as far as preventive management? We see that people in studies can, after 3 months, decrease their headaches by more than 50% and reduce dramatically their medication use. And this is what we're going after, because we don't want I'm not taking medication, but I'm taking Excedrin, Tylenol, ibuprofen. What do I do now? And this is where you can do dramatic impact. You can reduce the triptan use and other medication use. And what we're seeing in our clinically, we have many patients who have gone headache-free with using this approach. But the caveat is, in our clinic, we use multimodal approach. So we don't just address the acute medication and encephaly, we address sleep, nutrition, hydration, stress, and everything else. Now, how do we know it's not just placebo? And we don't, but we do have sham trials, right? And sham is done with very small stimulation. What do you guys see? That even sham, right, initially in the first month does decrease headaches. However, over time, if you use it for 3 months, people who were using the sham go back to their usual headache pattern, while this, over time, continues improving your brain function and decreasing headaches. And what we're seeing clinically, people start feeling better within 2 to 4 weeks, but they feel much better within 3 months. And to get probably full clinical effect, it takes about 6 months to a year of using this regularly. But it can be life-changing for many, many patients. Like I have many patients in their 80s or 90s that tried literally everything and nothing else worked. And this is very effective. There's a lot of, all the supporting studies, guys, are on their website. It's free, but you'll have my slides as well. And there are many, many clinical trials available. So Jane asks you, are there any long-term side effects, right? I want to use it for the rest of my life. You know, is it okay for me to use it? Most people don't want to use it for, most people want to use it for 6 months and then they want to be done. But I have some patients who have used it 3 or 4 years and it doesn't show that there is any problem long-term. We have been using neurostimulation now over 20 years with the implanted devices. This is external and we're considered very, very safe. So this is something that we use in pregnancy, breastfeeding, again, in post-traumatic headaches, migraines, and any severe headache, any headache that I don't know what to do for, where people go like, okay, I want to try something else. So she would like to try cephaly. She wants to know, are there any contraindications? So the only contraindications that we have is if you have metal that is not compatible with MRI, so patients who cannot have MRIs, I think it's more medical legal. I don't really think that, you know, it's significant stimulation, but that's the current caveat. And we were laughing because when it initially came out, in US, pacemaker was not allowed, but in Canada it was okay. So if you were Canadian, you could use it with pacemaker. If you were American, you could not use it. So it's a joke, but it's not a joke. So again, ask the cardiologist if they feel comfortable. They also have caveat that you should not use it if you have a severe epilepsy. Most of our epilepsy experts at UW feel that it's safe, that it shouldn't be causing problem. But again, just be aware of the medical legal repercussions, so know about this. So Jane doesn't have any contraindications. In the past, you ordered the device. Now it's actually Jane who's going to order her device because no prescriptions. During COVID, patients advocated, they said, if it's so super safe, why can't I just get it without a prescription, right? And so now they can get it without a prescription. So anyone can order, literally you can go online, you can order it, you can get it delivered within the next 1 or 2 days and you can start using it. You can use it for up to 90 days money back guarantee. I'm not associated with the company in any way. They have a payment plan for people who do not have a lot of resources, so it's like it fluctuates between $30 to $35 per month, or you can buy it, and it fluctuates again depending on the holiday season. It's between $300 to $400, sometimes $450. So Jane buys the cephaly device, she starts to use it, but she goes like, you know, like I don't know, like Natalia, you said it was okay, but it feels a little bothersome. So she asked, I still want to try it. What can I do? And so we said, you yourself can stop the intensity level at the level that you feel comfortable. And over time, this can help you. So many people who have chronic pain have allodynia. Have you guys heard of allodynia? I just touch the forehead and people will go, ow. But it's real. This is not in their head. This is the brain function, right? Being hyperexcitable. And then over time, this can normalize. In some people, if they go like, I absolutely cannot tolerate medications, devices, then you start with other things like the cognitive behavioral therapy and sleep therapy and exercise. And you have to like, instead of people coming to you and say, what can you do for me? You can say, well, what do you want to do as next step, right? I mean, we have a lot of options available for you. And people usually do. They start with cognitive behavioral therapy or something else. So she tries this approach. She has benefit. Her headaches have decreased by 50% after 3 months. And 1 year later, she comes back to your clinic. She had a gap in her care because she had problems with insurance. Her headaches have increased in frequency in the last few months. After a full evaluation, including imaging, you are not concerned about a secondary etiology, and you discuss additional non-medication treatment. It's still her preference. She goes like, still prefer, like if I can, I prefer not to take medications. So what other neuromodulation devices can you consider? So the one that's super popular now is Neurolivio. How many of you have tried it or prescribed it? So Neurolivio is actually approved for kids ages 12 and up. This is a prescription covered 100% by Blue Cross Blue Shield. The other insurances negotiate with so you put the prescription, I'll explain, but it's a remote electrical neuromodulation. So what is weird here, you actually wear it on your arm, right? But it treats pain. And it's controlled via smart app. So she goes like, how does Neurolivio work? Like, I mean, I have a headache, right? I mean, so it turns out it stimulates the brainstem inhibitory pain pathway. So it's, you feel the stimulation, it feels like acupuncture on your arm, and this will then activate the brainstem to stop the pain response. So it's called conditioned pain modulation. And she wants to know, again, supporting studies for this device. So what is the supporting study? So there are multiple clinical trials. There are prospective randomized double-blind, again, sham control. Sham means that I have the same device but at really low stimulation. Okay? What they found is that the 2-hour pain relief was close to 70% with the device versus 40% of sham. So even low, what does the sham mean? That even low level of stimulation can be still helpful, right? Probably not as helpful as the higher level. And 2-hour pain freedom is close to 40% of patients within 2 hours have no pain. So again, very, very safe device. And she wonders, what are the long-term benefits? You know, are there any? And so there are 8-week open label extension studies show significant decrease in usual care of acute medications, minimal adverse events. So the only events or adverse thing that people say, it feels like my arm is getting warm, it feels like acupuncture on my arm. They say it's equivalent to triptans. I would say it's actually more effective in our clinical kind of real world data. And we definitely it's superior to NSAIDs. So can I use this device for both acute and preventive treatment or just for one? And it's used for both. So acute treatment is 45 minutes. I feel a headache coming on. I'm going to use it. And this is, I have a lot of medical providers, a lot of our nurses, a lot of our physicians, because you can put it on your arm under your sweater. Right? And no one knows that you're using it when you feel a headache coming on. The preventive treatment is 45 minutes every other day. And so a lot of our patients, they, after they showered, you cannot use it in a shower. It's not waterproof. So it's electrical device. So after shower, when I'm dry, I can put it on as I'm getting ready for the day for 45 minutes. And for many, many of my patients, this was kind of big miracle because they were able to get headache free for using it 45 minutes every other day. So what does it feel like? So again, it feels like acupuncture. That's the best way I can describe it. But you feel stimulation of your arm. It's a warm, tingling sensation. It's not uncomfortable. Am I candidate for this? So again, majority of the people can use this for both acute and preventive approaches. We use it a lot for people who are at risk for medication overuse or prefer not to use medications or have medical conditions that prevent them from using traditional medications. It is now approved for kids 12 and up, and they have studies showing that it's safe in pregnancy. They did retrospective studies. And it's often for people who go like, I don't want to wear something on my head. I don't want to be the Wonder person, right, or Wonder Woman. You know, don't want to signal that I'm having a headache now, right? So what are the contraindications? So again, I think this is more medical legal, but it's not recommended in patients who have congestive heart failure, severe cardiac or cerebrovascular disease, uncontrolled epilepsy. Again, our epilepsy experts have no problem with them, but you should check with your epilepsy expert. And those who have implantable medical devices, like a pacemaker or hearing aid. So you're supposed to use it only on your arm, no other body parts. Do not use it if you have open wounds or rashes. Do not use it if you have metallic implant. Use it in the other arm, and do not use it on wet skin. Do not take it to the shower or swimming with you. So she's currently pregnant. She's asking, can I use this? And the answer is yes. The conclusion is that it's safe for treatment of migraine during pregnancy. There's no increased risk for adverse pregnancy outcomes. And we were using it even before the studies came out, because sometimes we get really desperate for our pregnant patients. So, and often what we use both the Cephally, like a preventive in the evening, and then we use the Neurivio. I'm working, and I need to use something at work. So she would like to start Neurivio. How can I get Neurivio for my patients? So all of you can go to neurivio.com. Currently, the pharmacy, there's only one location. It's ProCare Pharmacy in Miramar, Florida. So when you put it on Epic or whatever other system that you're using for putting your prescription, or you can just fax it to them, and they receive it the same day, and then they deal with the patient's insurance. So, and often they offer it to the patients for $50 a month if they do not have any insurance. Each device has the ability to treat 18 sessions. It's free for, all of these devices are free for your VA patients and military patients. Again, Blue Cross Blue Shield. Medicaid covers it now in some of the southern states, but not yet in Washington state. So they're trying to work with all the insurances, because my biggest concern is people who are vulnerable and don't have the resources. Now, there are other devices. So there's GammaCore. GammaCore is a vagal nerve stimulation. So this one, you do need to be referred to a headache clinic, or then you could contact the company and say you would want to be trained on that. But it's vagus nerve stimulation. So for all the patients who have autonomic dysfunction, dizziness, headache, and really disabling headache conditions like trigeminal neuralgia or paroxysmal hemicrania, all of those weird headaches, very effective treatment. And then Relivian was developed by Dr. Stu Tepper. So they approached one of our headache specialists in the US and said, if you develop the ideal device, what would it look like? And so he goes like, okay, I'm going to come up with it. And he came up with Relivian. And that's a device that is both trigeminal and occipital stimulation. And that one not only decreases headaches, but improves depression, anxiety, insomnia, ADHD. You can look at their studies, treats it all. Why is that? How is that possible, guys? Think about it. Like when Anita was telling you, she goes like, I don't really understand like how it's so complex. To me, it's not complex. To me, it's neurology, dysfunction of the brain, right? So if you have brain dysfunction, you have neuron hyperexcitability, you're going to deplete your serotonin and dopamine, you're going to have brain fatigue, right? You're going to have difficulty with sleep and autonomic dysfunction. So if you can have something that helps you normalize the brain activity, then guess what? All of a sudden, you're treating not only pain, you're improving anxiety, depression, sleep, and people feel much better. They're getting rid of that quote-unquote brain fog. We see brain fog in 90% of our patients. I have studies when they come to our clinic, but in majority of them, we improve that, right? By using these approaches. So what is the best device for my patients? So it comes to the cost and how well you can convince your patients, right? So if you go like, oh, I don't know, maybe it will work, maybe it will not, guess what? It will not work. So it's like everything in medicine, it's how you sell the data, right? And we often start with Cephally just because it's 90-day money-back guarantee. All of the devices used to be money-back guarantee, no longer, so only Cephally has that. All of the devices decrease. Anything that is preventive will decrease your headaches by 4 or more headache days per month. So if Jane came to you and said, I have 4 headache days per month I need to decrease. You can start one device, you're going to be golden. I have a lot of people who come to me and guess what? They have 30 headache days per month, everyday headaches, right? Have you had patients like that who have every single day headaches? One approach is not enough. One approach will decrease your headaches by about 4 days per month. If you want to have no headaches, that's where you need to know how to use the multimodal approaches together. Oh, and I think I'm at the end of my slide. So thank you so very much, guys.